Hello, and welcome to HEALTHline. I'm Susanne Whatley.
And I'm Jennifer Jimenez.
Have you ever had a visit to an emergency room? Well, as a matter of fact, I think we all have. You know, whether it be a broken arm or that sort of thing. I've accompanied friends to the ER too.
I've been in and out of the ER lately, accompanying my family member who's had a couple things going on. So, yeah, we all do it.
I'm always awestruck by, how these doctors don't know what's going to come through the door next. And, next thing you know, you might have somebody bleeding, you might have somebody with a fever, you might have heart attack symptoms. It's really just amazing. Well, Dr. Serineh Melidonian is our guest tonight, and this is Ask the ER Doctor time, but we're also going to find out what her experience is like working in the emergency department of Glendale Adventist Medical Center. Dr. Melidonian, thanks so much for coming.
Thank you. Thank you for having me.
Why did you pick emergency medicine?
I love the idea of being able to help anybody with any problem at any time. And I think that's the coolest thing. If you're walking out the door and you sprain your ankle, I can help you out. If you start having chest pain, abdominal pain, I can help you out. If you look like you're having a stroke, I can be the one. If you have something in your eye, I can help you either take it out or tell you what's going on. So I think it's really neat that at any time I could really be the person to assist, at least bridge the gap between now and a hospital or another doctor.
It's amazing. I mean, I'm so impressed and in awe of what you do. I think that it takes a certain type of person to do what you do.
I couldn't do it.
I know, I couldn't either. I'm like, What kind of patients do you get normally? Is there it's 12 o'clock and this is that kind of person that's coming in, or do you
You can never plan your day in emergency medicine. If the day you go in thinking, oh, it's midweek, it's a quiet day, I'm sure nothing's going to happen, something will happen, something comes in, and there's really no good time to take a nap or a break because you just don't know. Emergencies can happen any hour, any day. What is kind of exciting about it, and the reason why I picked it, was the fact that you really never know what's going to come through your door. And so at Glendale Adventist, it's not a trauma center. We don't see the car accidents come in with gruesome injuries or a gunshot wound or a stab wound. But that's only if they came in with an ambulance. If they walk in from a car accident, or if their friend drags them in from being stabbed, which we have seen at 4 a.m. on a random night, then everything is possible.
We'll have more about adventures in the ER when we return.
I'm Dr. Cardillo here at Glendale Adventist Medical Center, and today's theme is all about community safety. One of the big issues that we have come across in the emergency department is distraction. Distracted drivers, distracted walkers, distracted everybody. We're all on our cell phones, we're talking, we're reading, and this is presenting a big problem for us here in the emergency department because when people are distracted, they're getting injured. One of the biggest culprits are people that are distracted when they're driving. So please remember, do not text or talk or be distracted when you're driving. That does not only include cell phones. Do not eat when you're driving. Do not pick up newspapers. Do not put on lipstick. Anything that can distract you from your task at hand, which is driving to ensure your safety and the safety of others. So please pay attention and don't be distracted.
Welcome back, everyone. We're talking tonight to Dr. Melidonian about what it's like to work in an ER, and we actually got a lot of questions too, and we got on Facebook and Twitter, and we got very interactive. We got a lot of responses, so we're going to have a lot of questions coming up.
That's right, some really good ones.
Dr. Melidonian, what's it like on a typical day for you?
What we do in emergency medicine is shift work, so we show up at the start of our shift and pretty much take whatever comes our way. The way our emergency room is set up, we do have physician assistants that will assist with more of the urgent care type of patients with cuts, broken bones, things that need abscesses that need some treatment and surgical procedures. The rest of the patient load, primarily the chest pains, abdominal pains, weak and dizzy, those are patients that we will take care of as emergency physicians. The way our emergency room is set up, they're slightly separated from each other, but we're all working as a team together.
How long is your shifts? What's the longest shift you've ever had?
The typical shifts that we have are 10 hours, 10 and a half for the overnight shift. we've done longer shifts when the need is there, when it's just too busy in our emergency room. We will stick around and help the next people out because we're a team. We're going to work together to make sure everybody is seen in a timely fashion.
And Jennifer, you were just mentioning what a nice, beautiful new emergency room it is. It just opened a few years ago, and previously you had worked in the older emergency room, which was maybe a little bit more cramped quarters. Now this one's much bigger. Tell us about some of the features of the new ER.
Well, let me tell you about the old ER. I saw it first as a candy striper where it didn't seem as tight and congested.
How cute you were a candy striper.
I was. When I
love
was
that.
about 14 to 16, I was a candy striper. Then, we'll just say a few years later, I came back as an emergency doctor and worked there for 6 weeks before the new hospital opened. And then I started to feel how tight the quarters were, and now we are about 4 times the size of what we were before, if not
that's
larger.
fantastic.
The patient load we can see is about 38 at a time.
Wow.
And we are still expanding and figuring out ways to see more patients because we don't want patients to wait a long time in our waiting rooms. Typical door to patient time, so the minute you walk in the door and see the doctor, it's less than 30 minutes, and our goal is to actually bring that down even less. Amazing thing about the hospital is it is a primary stroke center. It is a primary receiving center for heart attacks. So if you are brought in by a paramedic and they see that you're having a stroke or a heart attack anywhere in the Glendale area that's within 20 minutes of us, you end up in our hospital because we are the best place to take care of that.
Well, I found out that it's one of the best hospitals in the region, which is so amazing.
I live in the area, but we are close enough to other hospitals. Within 5 minutes, 10 minutes, I can be at a different emergency room. My family is told you will only go to Glendale Adventist, not because I work there, but because I think you'll get the best care in the community.
Dr. Melidonian, talk about some of the improvements that you've seen in like the procedures, the systems, or the equipment that you're able to offer your patients now that maybe weren't available a few years ago.
The hospital has expanded tremendously. So with some of the facilities that are available, the ultrasound radiology is on the same floor, steps away. Operating room is 1 floor up. Just the sort of say geography and the map of the hospital has made it so we see and treat patients a lot quicker, a lot more efficiently. We have 2 rooms that are specifically decorated in Disney theme, very cute for the pediatric patients, and quite a few private rooms to be able to separate from.
I think I'd like the Disney room.
I went to the private room. I saw it. It was beautiful, like flat screens, everything. I mean, when we come back, we're going to keep talking to Dr. Melidonian, and we're going to have our interactive questions answered for you.